Hello friends, welcome again to Pharmabiomed concepts. In this tutorial, we are going to discuss a very important thing, that is inflammation, and how simply we can understand about the inflammation we see today. Let's move on to our tutorial. Coming to the inflammation. What is inflammation? Inflammation is a protective response to protect our tissues against any damage. If any damage happens to our tissue, our immune system immediately responds in the form of an inflammation. So, inflammation is a protective response. So, what type of tissue damages occurs? Basically, tissue damage may be because of some bacterial infection, some viral infection, or some external burns, or some cuts will be there. You are prone to some injury, or because of some of the autoimmune disorders, our tissues get damaged. So again, is this damage, our body will produce a protective phenomenon, that is nothing but inflammation. So there are different types of inflammations are there. So the basic categories of inflammations are, one is acute and other one is chronic. Acute means which happens immediately and it exists for a short period of time, whereas chronic means it happens and it persists for longer period of time, then that is called chronic type of the inflammation. Coming to this acute type of inflammation, when your body is prone to acute type of inflammation means when some allergens, when you are exposed to some allergens. The first reason is allergens and other one is infection, when you are prone to some infection because of a bacteria or because of a virus, or trauma, sudden shock may induce inflammation, or some burns, or some cuts, or some bites, some insect bites, which all leads to a immediate type of inflammation, that is acute inflammation. Then coming to the chronic inflammation. What is this chronic inflammation means? This happens in some of the diseases, such as some of the cardiovascular diseases and rheumatoid arthritis, which is an autoimmune disorder. In that, our tissues, most of the joints get inflamed, and cancer, in some types of cancers, your body is prone to inflammation, and neurological disorders, autoimmune disorders, these are all examples of the chronic inflammation. Now we should understand what happens exactly in the inflammation. This we try to simplify in 4 simple steps. Okay, so here the first is your pathogen has entered into your tissue and it started tissue damage. So the first step is what? The pathogen came into your tissue and it caused some damage to the tissue. So once there is a tissue damage, immediately our body will respond. So this is a blood vessel. So in the blood vessel you have all the RBCs which are freely flowing. Apart from the RBC, what else you have? You have WBC. So when the tissue damage occurs, when pathogen enters and it causes some tissue damage, what happens in the first step? There is a release of some mediators. Here the important mediator that is released is histamine. Apart from the histamine, there is also release of some prostaglandins, some bradykinins. These are all called inflammation mediators. So the first step in the inflammation is there is a release of some inflammation mediators, that is nothing but histamine, prostaglandins, or some bradykinin. So once the histamine is released against the tissue damage, what is the role of this histamine? Histamine causes vasodilation. That means the blood vessel gets dilated. When the blood vessel gets dilated, what happens? Blood flow increases, but blood flow speed decreases. The problem with this vasodilation is what? Vasodilation causes increase in the blood flow. At the same time, the speed of the blood flow little bit decreases. Because of this vasodilation, there is a slow migration as well as accumulation of these WBCs. These type of leukocyte, different types of leukocytes gets accumulated in this blood vessel. Apart from the vasodilation, what happens in the third step? There is an increase in the permeability. So the wall permeability, the blood vessel permeability gets increased. Because of the increase in this permeability, whatever the leukocytes which are accumulated, they start to adhere to this epithelium, this cell wall, and they start to migrate towards the tissue spaces. So the first step is tissue damage, the second step is vasodilation, and the third one is increased permeability of the blood cell walls, cell wall capillaries. So here we said about the leukocytes. So what are the leukocytes? They are going to be accumulated here in the blood vessel. So immediately within 24 hours of the time, the first type of leukocyte that are going to be accumulated are neutrophils. So the first cells that are going to be accumulated are neutrophils. After the 24 hours, within a 48 hours of time span, again your macrophages also gets accumulated in the tissue damage site. So these are the two important leukocytes that are going to play a major role in the inflammation. Once there is an increased permeability, now the neutrophils can easily enter into the tissue spaces where exactly the damage has happened. So here one more is the phenomenon called chemotaxis will be initiated. What is this chemotaxis? Because of the pathogenic entry into the tissue, it releases some chemical signals. So these chemical signals will initiate our immune system, some of the components of the immune system. For example, leukotrienes will be there. So these leukotrienes gets activated and they attract these leukocytes, these neutrophils into the tissue spaces. So there is an attraction between the chemical signals that is generated by the pathogenic microorganism or any of the reason of that inflammation with the leukocytes or neutrophils which are accumulated in the blood cell wall. So this is all happens in the third step. All are fine. Now there is a very good number of leukocytes or neutrophils are getting migrated into the tissue space where exactly the tissue damage has happened. This phenomenon is called extravasation. So this is the very important step of the inflammation. So in extravasation, what happens? Whatever the leukocytes are there, whatever the neutrophils are there, they first attach to this epithelium. This epithelium is there, right, in the blood vessel, or blood vessel capillary is made up of epithelium. So initially they attach to the epithelium. So this attachment is enhanced by endothelial adhesion proteins will be there. So this capillary endothelial adhesion proteins will be there. They causes adhesion of these leukocytes or neutrophils onto this blood cell wall. Once they are getting adhesion, that means they attached perfectly, then they come out of this epithelium and they released into this tissue spaces. This is called extravasation. So the movement of neutrophils from the capillary wall to the tissue spaces where exactly the tissue damage has happened, the inflammation site, this is called extravasation. Now there is an influx of neutrophils, then they start to engulf the pathogenic microorganisms or any microbial products. This is called phagocytosis. So in the fourth step, phagocytosis is going to happen after the extravasation of the neutrophils. Phagocytosis means killing of the microorganisms or killing of some of the microbial products or any pathogenic products or any causative agents which are going to cause the inflammation. Once the phagocytosis has been done, immediately the wound healing process gets initiated and the wound starts to heal. The clotting factors gets initiated. The clotting factors induces the blood clotting which is going to initiate the wound healing process. So you can see the complete inflammation in the 5 different steps where it starts with the tissue damage because of the inflammation mediator releases, vasodilation, increased permeability, and finally extravasation of the different types of the leukocytes into the site of tissue damage. So this is how the inflammation will go on, and generally inflammation is characterized by the redness. Redness, why? Because more amount of blood is flowing here. So because of that, wherever the tissue damage is there, that is turning into a red color. So redness will be there. Swelling, why swelling? Because of the increased permeability, there is a leakage of all blood fluid into the tissue spaces. Because of that, swelling occurs. As the fluid volume increases, obviously there will be a generation of the heat. Because of that, there will be increase in the temperature of your body. That is called heat. So when redness, swelling, heat are present, obviously the pain gets initiated. These are the 4 main characteristics of the basic inflammation. And finally, if the inflammation is turning into the acute from the chronic stage, there may be a permanent inflammation of that whatever the epithelial tissue here it is there, which leads to loss of the function of the whatever the site where the tissue is getting inflamed, which results into different types of the diseases. For example, in the chronic inflammation, you can see a permanent inflammation of the joints in the rheumatoid arthritis. For example, one more example is Crohn's disease, ulcerative colitis, where there is an inflammation of your GIT tract, autoimmune, different types of autoimmune disorders. In cancer, there is an upregulation of the apoptosis because of these inflammation. So these are all leads to chronic inflammation. So I think now you are clear with what is inflammation, what are the main steps of the inflammation, what are the characteristic features of the inflammation. If you like this video, please subscribe, share and pass it to many more. And if you have any queries, please post in the comment section and follow my Facebook page so that you will get all the regular updates. Thank you one and all.